Good afternoon, and welcome to our training on the North Carolina Functional Assessment Support Teams responding during COVID-19. And can everyone hear me?
Yes.
Yes?
Yes.
Great. Okay. Fantastic. Okay. Well, thank you all for being here. My name is Sherry Badger, and I'm the North Carolina Emergency Management Disability Integration Specialist and the Program Manager for the FAST Functional Assessment Support Teams. As many of you know, these are new and different days with the COVID-19. I'm fully expecting that there is going to be a hurricane or two in our horizon, which means that there will be evacuations and therefore shelters needed. I don't think this is a opportunity for us to sit this one out because it is still the responsibility of all jurisdictions to make sure that people with access and functional needs and those with disabilities have the needs and the access to the programs that are afforded to everyone else. So I think it's very important that we continue what we're doing. And in that vein, we will be working on virtual FAST teams, preferably, and then if need be, in-person FAST with some virtual backup. So what I did was took a lot of the slides. If you've taken the FAST training, the full day training, you will recognize some of these slides. What I've done is gone through, and anything that is in green text is new and has been adapted for COVID-19. So we went through and reviewed what our program looked like and how that would look different doing it virtual in COVID-19 environment. So thank you very much for being here. We'll have questions at the end, and we'll take them via chat box, but also verbally as well. So just a quick review of the FAST mission. It's the retention of independence and inclusion of affected individuals in the shelters, strengthen the community's disaster resilience, and individuals may receive services not just at shelters, but at disaster service centers, which include shelters, but may also include disaster recovery centers, points of distribution, pods, points of dispensing, or any other public-facing disaster service center. It is also the mission of FAST to reduce the impact on medical support resources. Rather than sending anyone who may have a disability to a medical support shelter, which of course we all know is not necessarily needed in all cases, that we're able to get the resources that they need to live or exist as independently as they can in shelters. Now for this year, the shelters are going to be congregate shelters. Congregate shelter is a shelter that we are traditionally used to, like a school or a church or something like that, where everyone sleeps in cots next to each other. A non-congregate shelter is a shelter that usually is used for very special circumstances, and we need to get waivers from FEMA in order to have those non-congregate settings. And those would include hotels, motels, campgrounds, dorms, anywhere that it's private or semi-private. So usually those are not reimbursable by FEMA, except for this hurricane season or this season beginning June 1st and running throughout the hurricane season. So the main purpose, the main thrust of what the FAST program does and the FAST responders do are to assess needs, offer support, and be creative in addressing the needs of shelter residents who have disabilities and/or access and functional needs. So one of the things that we're going to need to do is be even more creative this year, and we are going to have to use some of our other skill sets aside from direct observation. I know that's a main thing that we've taught folks in our FAST programs is the power of observation, watching folks, seeing how they interact with folks, seeing if there's anything that maybe people aren't ready to self-report yet, but they may need assistance. So we're going to have to work on our and strengthen our interviewing, assessing over the phone, assessing perhaps even via video chat and those sort of things. So we'll have to be even more of MacGyvers than we were thinking before. So one of the first things that we did was look at putting together a standard operating guideline for utilizing FAST in the COVID-19 environment. So everyone should have gotten a copy of this in the calendar scheduler. So this is basically outlining how we are going to operate during COVID-19. And there's basically 4 different scenarios, and I even see some of those scenarios wrapping into each other. So there's the scenario where the FAST would be working virtually in a non-congregate shelter, a scenario where we would be working virtually in a congregate shelter, where we would be working in person with a limited team with virtual support in a non-congregate shelter, and then also same in a congregate shelter. So if anyone has any questions, I believe it's 3 or 4 pages, but it gives you a good outline of what this webinar is about. So as I mentioned, the preferred method is going to be virtual FAST in congregate shelters and non-congregate shelters. And what may end up happening is we get requested to a county that is utilizing both of those methods. So we may go, we may virtually be talking to some folks that are in a congregate shelter, and the same time in the same county be talking to some folks in non-congregate shelters. And the same thing for in-person FAST response with virtual support. We will send, if need be, we will send a team of 2 people into congregate shelters or non-congregate shelters, depending on the situation, and they would have some virtual backup. So this might be someone who is maybe listening in into conversations, maybe be the one that is back at their office, home office, and writing up or typing up the request, the resource request, doing the reports as the in-person teams are making contact with the people in the shelter. So FAST responders. You all as FAST responders will help affected residents maintain their health independence and safety by assessing the immediate needs of affected individuals, initiating support requests for services, equipment, and supplies, and ensuring services, equipment, and or supplies make it to the correct individuals. So that is no different than what you are tasked to do a year ago when you took this training. So the purpose is still the same. And as a FAST responder, you're expected to deploy to work assignment, whether in person or virtual when requested. So whether in person or virtual is, as you can see, is in green. So that's different this year. Assess immediate needs of affected individuals with access and functional needs with the assistance of in-person staff when needed. So one of the things that we'll be doing is as we go to shelters, or even as FAST coordinators before we start assigning folks to shelters, is to understand what the shelter structures look like. So part of that will be identifying not only the shelter managers, but how the shelter managers are connecting or communicating with the shelter residents. For example, if they're in a non-congregate shelter. So as people are coming into hotels or motels, how are they being communicated with? Is there any on-site person that may be able to assist our FAST teams because they are on site anyways? getting communication information to them. One thing we've developed, and I think many of you have seen it, has been a flyer that we want to make available to residents in non-congregate and congregate shelters, and where they themselves, the residents, can contact us if they have any needs in locating resources or services to assist with access and functional needs and disabilities. So we'll be looking at identifying the various staff that may be available to assist us and be the ones that are on the floor, because they're there anyways. Fast responders will also initiate support requests. So whether you're the responder in person and working in a non-congregate shelter, and then you have a person who's working virtually and assisting you, either one of you may be doing the virtual or the resource request. And then ensuring resources delivered to the appropriate individual. And this would be with assistance of the in-person staff when needed. So as I mentioned, the few staff that will be there, and it may even be one staff if it's a non-congregate shelter. We would have a congregate shelter or non-congregate shelter site coordinator even, but they would be able to assist in making sure that the supplies or resources get to whomever they are needed to get to. So we will continue to have fast response team leads, so fast leads. And as you know from the past training, these team leads, if there's 2 or more people, then one of those folks is going to be the team lead, and they will be the connection and the team lead, the connection to the shelter manager. And then they also will be the one that relays any information from the shelter manager or health services back down to the FAST team, and that might be virtually or that might be in person. So the FAST response team lead, as before, initiate and maintain communication. The communication methods may be a little different this year. Coordinate information flow, and this is going to be very important because we're going to be relying on that communication and how we're going to be doing that, and not so much depending on the face-to-face information. They'll be leading and organized meetings, and some of these meetings may be virtual, they may be telephonic, they may be webinar meetings. One of the things, if you're not familiar with webinar platforms, to maybe become familiar with that. Compile and organize paperwork, prioritize and track support requests, monitor distribution of requested resources, oversee the demobilization, and communicate with the FAST coordinator. So none of this is new as a FAST coordinator lead. It just may be, as a FAST lead, it just may look a little different this time. Now the FAST coordinator duties. These are very similar to what we learned about and what their duties are. We currently have 2 FAST coordinator in training, and that's Vicki Smith and Lauren Howard, and would love to have some more recruits. So if anyone's interested in that, please let me know. The difference with this one is going to be that they may work in the State Emergency Operations Center in Raleigh or virtually. Of course, I'm always going to prefer virtually, but that just means that there's going to need to be more communication with the Disability Integration Coordinator or the Human Services Branch Manager via phone, as well as making sure that they're understanding WebEOC and the NC terms, which is our team management system. So second FAST coordinator duty is to contact FAST responders for deployment notification, whether in person or virtual. So they will continue to do those notifications, and you will get notified in the same way, whether you're getting deployed virtually or in person. So if we need you virtually, you still get a notification like you do on your monthly notification tests. The FAST coordinator would continue to monitor Web EOC resources, resource tracker, and respond to requests. That is an internet-based service. If you do have, if you have internet, that's going to be an important part of your role. Collect and disseminate information to deploying fast responders, including in-person and virtual. So making sure and keeping in contact with all of the responders, even if it's a virtual responder, keeping up with whether or not they've contacted the shelter manager, whether they've had any issues, the resource requests, et cetera. They continue to provide support to deployed fast responders and maintain contact with fast leads. So even during the demobilization phase, making sure that people have turned in all of their paperwork to the fast leads have turned it into the shelter manager and the coordinator, making sure that people have signed out and have finished everything up. So for teams deploying to a shelter, and they will check in with the shelter manager, and this is for either in person or virtually. They will check in with the shelter manager. So in either instance, the team leads can expect to get the contact information and connect with them somehow, either if they're deploying in person, still contact them, let them know they're coming. If it's virtual, call them, introduce themselves, and then get a briefing from the shelter manager. The shelter manager may or may not have an idea of people that may have self-identified as needing resources or services ahead of time, or they may be able to assist you in starting your process and giving you contact information for the folks that are in the shelters. Also connect with health services and mental health services. They may also as well have ideas of folks that have self-identified or just in their conversations with them may be able to assist you in getting you to the right people that might need those resources and services. FAST members will receive a briefing from the FAST lead, either in person or virtually. And if you're doing this virtually, you may end up wanting to just do one phone call, maybe a group call with the shelter manager, so everyone gets the same information at the same time, and that might be helpful. All right. So preparing for in-person deployment, and many of you may remember this part where we put together a personal go kit, a fast go kit, get clearance from the FAST coordinator, and then approval from your agency or department. So none of this changes. Whether you're going to be responding virtually or responding from in person, we'll want you to have all of these. And the most important would be approval from your agency and or department, so they know that you're doing this, and clearance from the FAST coordinator. Want to make sure that we're connecting you with people that are have requested you, and that when we do our call out for anyone who's interested, we want to make sure that that we don't send too many people to the same spot. So for your personal go kit, the personal go kit, the only thing different if you are actually going to be deploying in person is adding personal protective equipment, so PPE. And on the next screen, I'll go into a little more detail on the PPE. And then the rest of the other things in your personal go kit, we are going to look at providing the PPE for in-person fast responders, but there also might be some, you might have preferences in what you're wearing. So rather than the disposable masks that we give you, if you have your own cloth masks that you would prefer to use, then that's where I'd put that in. Also, you might want your PPE if you're responding in person and you end up going to a shelter overnight somewhere else to spend the night, and you just want some of your own cleaning supplies or something like that. But we are looking at putting together PPE kits for the responders. I mean, we will. We're not looking at it. We are putting kits together for our fast responders. So here's an example of some of the PPE. We've got some things that are recommended and some that are required. Gowns, if you can get your hands on them, if we can find some for you, recommended, but that's really not necessary unless you're going to be interacting with anyone in an isolation unit in a congregate shelter, which may occur, so you might want to have one or two of those available. The other thing I want everyone to know too is that we are working at North Carolina Emergency Management to make sure that shelters have the PPE equipment needed to run the shelters, which would include all of these things. But we also not sure exactly if every shelter will have it by the time the shelter opens, or if the items will be there after the shelters open. So always will be good to have your own PPE available, and I'll continue with the other things. Masks, of course, are required. Goggles are required. Many of you may know this, but one of the ways that the COVID-19 virus can get in is through your eyes. So that's one of the things I want to make sure that people, if you're going to be close around people, that you have goggles. Gloves are not required, but recommended. If you end up, like I mentioned before, if you end up in an isolated area or coming in contact with someone who is coughing or something like that, that you will have the gloves. Hand sanitizer, recommended, but we'll also make sure that that's part of the PPE. Disinfecting wipes, recommended, and we will also be making sure that that's part of what you have, so you can wipe down everything, the office area or the workspace that you're in, anything else that you touch, high touch areas around you. Even if you need to assist in the resource requests and then receiving those resource requests, maybe wiping down the equipment that has been requested. So, and just a little instruction on how to wear a mask and not wear a mask. And Christine Bowman, if you're on the line, that's for you with the dogs. Okay. So the suggested Fast Go Kit items are the same thing as we had before. The only additional item would be personal protective equipment. And all of the rest is pretty straightforward and exactly what you would expect. So preparing for virtual deployment, you would have your virtual Fast Go Kit, have your clearance from the FAST coordinator and your approval from the agency department. So let's see. So your suggested virtual Fast Go Kits includes the access to forms. So these are all the forms that we utilized during our training, and can be found at ncdps.org/ncfast. And I'm sorry, I'm getting some feedback. Could everyone put their phones on mute? Is everyone's phones on mute, please? All right. Thank you. So preparing for the virtual deployment, virtual fast go kit, access to the forms, office supplies, phone, computer, making sure you've got internet connection. So I don't know if you need a hotspot or something. If you don't have these items, or if you don't have the hotspot, maybe we can assist in getting you one or getting you near. And then a phone number list, and then of course snacks. Snacks are very important if you're doing it virtually. Make sure your day goes very nicely. So the big question is going to be connecting with affected individuals. How do we do that? Well, we take a page out of our initial training and use a building layout map if available. And this is going to be good for virtual and or in person. Because if you have a good idea of, say, the hotel that someone's staying in or people are staying in, you can get a better understanding of, access to elevators, access to the services that the wraparound services that they may be providing at the hotel, how people can get to them, and so on. You can ask the site staff if they already have identified those in need of assistance. So that would be the shelter coordinator if it's at a non-congregate shelter, or a shelter manager if it's at a congregate shelter. You would speak with the affected individuals individually, making sure that things aren't being overheard by others, and privacy and all of that stuff that we've gone over before. And then if needed, making sure that you arrange to meet residents at specific times or locations. So this is going to be particularly important as we do callbacks and calling folks to identify if there's any need, and maybe interviewing people at times that are more convenient for those folks. So the virtual FAST initial assessment forms. So these are, we adapted this from the CMIST form that the Red Cross put together. And this is the CMIST form, for those of you who are not familiar with it, are forms that are used once a person is registered into a Red Cross shelter, and they are asked if they have any additional needs. If they do, they will go to the health services, and they will continue on with this questionnaire, the CMIST questionnaire. I adapted it slightly for initial assessments for us, because most of the folks, well, every person that we interview is going to have already gone through the registration process. For those folks that don't continue through the CMIST interview process, this is a great way to start that. With everyone's backgrounds and skills, these aren't the only questions to ask, but these are good questions to start off to kind of be the diving board into the pool of questions that abound regarding people's resource needs and requirements or services. So please feel free, use this to connect with on-site shelter staff. The other thing too is if they have gone through the CMIST worksheet, being able to utilize information off of the CMIST worksheet. So you can ask the shelter staff if they did fill them out, and if they did, then that would be a good place to start as well. You also want to get a list of names and contacts of people at the shelter. You should be able to be doing that with the shelter manager, and whether it's congregate or non-congregate, being able to identify folks or just doing cold calls to all the folks should be a good way to start, and then using this initial assessment form. One of the things that I've heard in the Red Cross process and how they're going to be working, because they themselves as shelter workers are going to be trying to work as virtual as they can, which would include health services and mental health services, as well as spiritual services. So it's been indicated to me that there might be days when people get called by spiritual services, days that people are called by mental health, and it just rotates. So we may be able to contact any one of those representatives and work with them to see if they've identified or heard of any needs, or we may be in the rotation of people getting called. So everyone's not getting called by 4 different people every day, but it gets rotated throughout their stay. So same thing that I just mentioned, review the FAST initial assessment worksheet and identify potential needs, contact and talk with the folks, the clients, contact the shelter manager and health services for possible on-site resource availability. So as we mentioned in the initial training, there may be some of those items that are requested that are actually on-site, or things that can be utilized in lieu of items. So maybe some ways to transport some things around might be a luggage rack. There might be a service elevator that might be able to be used. So being able to find if there's anything on site first, or if a support trailer has been delivered, knowing what's in the support trailer, so we can utilize all those things that are around them first before actually making the resource request. And then if beyond that, if needed, then we fill out the FAST resource request form for resources or services, and then send to the shelter manager for approval. So that's not too much different from the process before, just making sure that we're connected with the people at the shelters that are coordinating the shelters, that are running the shelters, or managing the shelters, and they can be our eyes and ears if need be, and also our hands if they can get their hands on some of the shelter resources. And just to review, the ICS 213, this is the FAST resource request form. Just like you would if you were there as a FAST team last year, you'll be doing it this year, but you may be filling it out from the comfort of your own home on your computer, and working with the clients at the shelter. So you use it for each request. You use it to document the request and track the progress, and then keeping the copies for follow-up. So we can tell when people get them. You can mark the fact that they received it on your version of it. And again, we'll utilize scanning apps on phones or on computers to make sure everyone has copies of all of this, including the FAST coordinator at the end, the FAST team lead, and then the shelter manager as well. So just to review how to make the resource request, and this is all in blue, so it's not any different than it was before COVID. A request is made to the county emergency manager with the disaster service centers or the shelter manager's knowledge. And this is after we've talked to the shelter manager and noted that there is not a resource available on site. The local emergency operations center or regional court or RCC will be given the request. If there's nothing, if they don't have access to the needed supplies, it would go to the State Emergency Operations Center. and then we will get it at the Human Services breakout room. We will work with our Emergency Services section, the Business Emergency Operations Center or Logistics to find the requested resource. And then the resource will get sent to the shelter, and then FAST will make sure that it is delivered to the right person. Doesn't necessarily mean that you have to do the delivering, but just follow up with the person who is supposed to receive the resource to see if they did in fact receive that. So FAST quick notes. These are also going to be similar and done in the same way, even if you're virtual. So this will, I think, be even more important between using this and then the next slide or the next form, the ICS 214, the activity log. That will help you identify the resources. So the FAST quick notes, one page is for each person that you talk to that actually has identified a need. And then the activity log will be for every single person that you call in contact with. And this will help in making sure that everyone has been contacted. You can go back and list out each person that you contacted. If the contact results in someone needing a resource, then you can pull out the FAST quick notes and use the notes to help further identify what the person is needing and what your plan is to meet the needs of that and what the outcome of that plan was. So again, this is the activity log, so that will help you keep track of people who you've contacted, people who maybe you've tried to contact but you didn't get a response, or that you're waiting to hear back from someone you've left a message. Demobilization and the transition of FAST. So at the end, it's going to be very similar to a regular in-person deployment. It will be overseen by the FAST lead for that site, and basically a debriefing with the FAST responders, and then the FAST responders will establish priorities on how, if they're leaving before the shelter is closed, who needs what, if equipment needs to be returned, and then making sure that the FAST lead gets all of the paperwork. So all of the 214s, the quick notes, and any other notes that you might have. The FAST lead will then give all of that paperwork and all the information to the FAST coordinator, and everyone will, if they're responding virtually, they will just basically sign off, end of shift, and end of deployment. If they're in person, then they will keep in touch with the FAST coordinator until they are returned back to their home site. So that is all of that in a nutshell. Do we have any questions? I know that's a lot of information.
Sherry, I have a question. This is Carlotta Dixon.
Hi, Carlotta.
How will FAST work, if they would work, with the reception centers? I'm hearing this concept that's going to be introduced because of coronavirus pandemic. They're going to be reception centers, and I don't have a clear picture of all that. That was presented in the EM forum, so I'm just asking a question. Will FAST even have a role in or at those reception centers?
That's a very good question, Carlotta, and I wish I knew 100% what that answer was. it would seem that that would be a great place for fast responders to be. I'm not sure, and actually I've been tasked to do the standard operating procedures for the reception center. So I'll be working on that. One of the goals is to get people in and out as fast as they can. So from the reception center registered and to the correct location. So I'm not sure if we would maybe initially identify people that could be followed up with at a later time. And so that might be something that we can incorporate into the process. And maybe as we are working on the reception centers, where people would go to find either a congregate, be assigned a congregate or non-congregate shelter site, let me think about that a little bit more. I think that's a great idea. I appreciate you bringing that up, and I think there's a place in there for either a checklist or something. Maybe at that point is where we give the folks that may self-identify the flyer, or as they're registering, we make a note next to the person on the registration list of someone who may have self-identified as needing assistance. And then once they get to the shelter, then we can contact them. But thank you. I think that we do need to think through that.
Sherry, this is Christina.
Hi, Christina.
Hello. You said something earlier. I kind of wrote a question in the chat box while you were talking at the same time, so now I'm trying to remember. But so talking about doing virtual appointments via phone calls or sort of like virtual meetings using some of the internet web platforms like Zoom or whatnot. And you said something about maybe kind of getting familiar with some of the platforms. So I was wondering if for those sort of like basically like teleconference meetings that might be set up, would individual fast responder, like if they were using Zoom or whatnot, would they be expected to create and use personal accounts with whatever webinar platform, or would there be something provided like for fast responders, like a specific account for that? I know I have access to one for my division, but of course that's for work associated with my division. So I was just wondering about that.
Yeah, so let me check on that because I'm not sure of the exact details. I know we at North Carolina Emergency Management use WebEx. I'm not sure how easy, I'm sure it would be easy for different folks to utilize that. And perhaps it can be just as easy as having the FAST coordinator set up the WebEx call from emergency management side of things, or utilizing FaceTime or that sort of thing, where if you have access to that. I don't want to make things too complicated, but let people use the tools that they have available and are familiar with. If people end up having questions, we can figure out how we want to do that. I guess I would envision maybe having some team meetings if we've got a variety of virtual FAST teams out there. Maybe we all get onto a WebEx call at the end of the day or something like that. Or it can be just as easy as just doing a conference call. So we don't have to get into too many details and who's got access to what. So we might do that. So any other questions?
This is Christina again. I'm always full of questions, so I don't want to take over anyone else's time, but do you think there's something like a little one pager or something that you all might sit down and develop as a little bit of a quick guidelines on if there is going to be a in-person deployment or whatnot, going to be a fast responder at an actual shelter in regard to sort of how to properly wear and use PPE?
Yes, and you asked me that question before, and so I talked with our environmental specialists with the public health, and there's they actually don't have like recommendations of after 2 hours you should switch out masks or that sort of thing. I think because we're going to be using just goggles and masks and then hand sanitizer and wipes and that sort of thing, that the recommendations may be, use one mask per day or one mask per site. But even they've looked through the guidelines, and there's not really anything based on the shelter guidelines for CDC or the Red Cross shelter guidelines. It would only be if you're in the isolation part of it and how that would work. So I'll continue to look for some more information on that. But yeah, I think that's important.
Okay, thank you.
Mm-hmm. All right. Any other questions at all? As you can tell, this is a developing process and procedures. One of the things I'm anticipating and is during our exercise on August 17th, that as we walk through this process, that we'll find out where some gaps are and be able to address them before we actually have to truly deploy, whether virtual or in person. So a lot of the things that we're doing in emergency management to get ready for hurricane season and COVID-19 is all just based on people's CDC guidance, on Red Cross guidance, and people's best guess based on their experience and what they've seen. So the opportunities to practice this and get this right, and we're going to have a lot of chances to do that. So I appreciate everyone, and please feel free to give me a call, or if you have any other questions, to email me, text me, or whatever. I value everyone's input and appreciate you all spending your afternoon with me. As I mentioned before, this is being recorded, so will be available and up on our website within a week, so people can go back and refer to it. I also will make sure I send out a copy of the PowerPoint to folks, so you all will have that and can use that for notes as well. So thank you, and have a great Monday.
Barry, there was one more question there in the chat.